Hello and welcome to this short session for the Mini All About That Place 2025, and I'm going to be talking about district nurses in your place for the Society of One Place Studies. So, district nurses were an integral member of the community. Before the establishment of the NHS, which was in 1948, district nurses were part of most urban and rural communities. They continued after the NHS was formed, but they were already an integral member of the community. They cared for expectant mothers, babies, children, right throughout adulthood to the elderly members in their community. They delivered babies, and at the other end of the life scale, they prepared people who had died ready for burial or cremation. All members will have known the district nurse. And as in this newspaper article from 1926, it stated, she is soon a figure well known throughout the countryside, for the rich and poor alike. So when did district nurses start? The district nurses that we think of today actually started in 1859 in Liverpool. But before that, in 1840, Mrs. Fry, Elizabeth Fry, set up the Institution of Nursing Sisters. They weren't trained, but she started with 20 nurses caring for people within the community. Then the district nursing actually set off from Liverpool because the term district was taken from there were 18 districts in the city of Liverpool, and a nurse looked after each district. Then other cities followed. There were 3 other groups in London. East London Nursing Society had district nurses in London in 1868. There were the Bible Women connected with Guy's Hospital in 1875, and in Bloomsbury Square, the training school for district nurses became the Metropolitan National Nursing Association. But it wasn't till 1887, with Queen Victoria's Golden Jubilee, that district nursing really took off. The Queen gifted £70,000 for the education of nurses to care for people in their own houses. So totally different from caring for people within a hospital setting. And branches were set up in London, Edinburgh and Dublin, and therefore it grew nationwide. The training covered public health, things like sanitary reform, health education, ventilation, water supply, and education of health like diet and feeding and care of newborn babies. And it also incorporated infectious diseases and sexual health for the first time. 10 years later, the Institute introduced County Nursing Association for rural areas. So these are the county rural district nurses that we think of in the past. And that association employed qualified midwives known as village nurse midwives. The number of district nurses in community nursing massively increased from the 1930s, within the 1930s and onwards. So very much between the wars, there was a 3 times increase, including midwives and trainees. So how did these people, these women, as it was women, how did they get about? Well, going back to the 1880s, a pioneer county nursing was Elizabeth Malleson from Gotherington in the Cotswolds. And she was of the era where, before the introduction of bicycles, a directive of 1892 stated that one nurse can efficiently nurse a rural district within a radius of 3 to 4 miles of her home where a donkey and cart is provided. Nurse Elizabeth Malleson had 2 donkeys and a bicycle to serve her district of 9 villages and hamlets. By 1910, she had funded her own pony. She wanted to get around a bit better. It wasn't until 1952 that there was a request to Parliament to have motor engines fitted to the bicycles of district nurses, as they found it very hard work pedalling a push bike as well as doing a shift of nursing. So back to the NHS. The NHS was established in 1948, and as I mentioned, the district nurses belong to the District Nurse Association. It wasn't till 90 years after the establishment of that the distinct community nursing role transferred to the NHS. District nurses were often on duty 24/7. Everybody knew them. They had people knocking on the door before telephones were provided, and then they had telephones that were ringing day and night with just them to answer the call and go out. In the 1950s, the NHS opened welfare clinics throughout the country. These were run by local authorities, but very often it was the district nurse who was involved in the running of them. And the prime area for this was health education and preventing illness, very much as it is today. There were earlier clinics pre the 1950s. I've taken these from the National Archives Discovery site. In Brighton, 1938. In Lewisham, a maternity and child welfare clinic from 1937. And in Longton, Staffordshire, they had a maternity and child welfare school clinic from 1937. And there's the reference numbers there if these happen to fall within your one place study or your area of interest. So I'll have a case study now. This is a painting in the public domain of what a district nurse probably looked like in the early days. Always thought of, and did have capes. So we have Anne Rowe here, who was on the 1901 census. She was living at 16 Cherry Street in Warwick. And on the census, her occupation was Queen's District Nurse. So this is from Queen Victoria's Jubilee. She was 45 years old and single. That is very much the norm. People up into the mid-20s were seen as too young for the role. People in the late 40s onwards were seen too old for the role. She was born in Glamorganshire. So, identify from the censuses the district nurses in your one place study, and then we can take it a little bit further. If you go on to one of the old maps, I use the National Library of Scotland. Here we can see where Anne Rowe was living, where the arrow points. That's where she lived. So it's nice to conjure up ideas of where did she travel? How did she travel? Did she go on foot? Did she have a bicycle? Did she use a tram? If trams had got going in Warwick by that point. But very close by to where she lived, here there was a children's home. So she was probably very involved in that. So it's starting to add a bit of character to your one place. So use a map to plan routes for your district nurse in your one place study. So thanks to AI and ChatGPT, I have got these images. So, did the district nurse go on foot? Did she go on a bicycle? Or was she using public transport and trams to get about in a large urban area, perhaps? So, considerations for your place. Is your one place rural or urban or both? Was there street lighting? And when did this arrive in your place? That would have made a massive difference for your district nurse being able to get about, because they were out at night as well. Was there running water? When did that arrive in your place? Was she able to wash her hands? Were there indoor toilets? So a lot to do with sanitation, health education, public health. All these are massive considerations in district nursing. What were the roads and lanes like for riding a bicycle? Was there, and when did it open, a welfare health clinic in your place? Was there a nearby GP working with the district nurse? And where was the nearest hospital? These are just some ideas, but it gives you a start to kind of integrate the district nurse within your one place. If you want to bring your one place study alive or to life, you could add a historical video of a district nurse at work. So there's two here. Feel free to take a photograph of this slide. And there is one for 1942 and there is another for 1945. And these give a really good insight. So records for nurses are held with the Royal College of Nursing in Edinburgh. Registration for registered nurses opened in 1921. So you'll see records mainly from then, but you will see district nurse records. Online records for all nurses, you can access this on ancestry.co.uk under the record set UK and Ireland Nursing Registers 1898 to 1968. But the Queen's Nursing Institute roll of nurses is the district nurses, and this is 1891 to 1931, again on Ancestry. Look at census returns and the 1939 register and electoral registers, and you're looking for district nurse or Queen's nurse to really verify a district nurse. So I hope that's been interesting and useful. Please do not hesitate to contact me with any queries, and you can contact me on my email, storiesofourgenerations@gmail.com. Thank you.